cancer and its elevated risk for black men. And joining us to facilitate that conversation, Dr. Arnold Bullock and Dr. Lannis Hall. And good morning to both of you.
Good morning.
It's good to have you with us here today. Our conversation brought to you by Marcus & Mack, a law firm representing injured people. Just so folks know, Dr. Bullock, you are, what is your specialty?
I'm a urologic surgeon, and I specialize in prostate cancer and men's health.
And Dr. Hall?
I'm a radiation oncologist, and I specialize in prostate cancer treatment.
All right, so let's get into this topic because we don't have you for very long here this morning. And Dr. Bullock, let's start with you. And the obvious question is, why is prostate cancer more prevalent in black men than in others?
It's not clear as to why African-American men are diagnosed with prostate cancer more commonly than whites. But it is 70% more likely in blacks than in whites, and we can pick up prostate cancer in an earlier stage, such that no one has to die from this disease if they participate in screening.
Are you finding resistance to that initial visit, that screening?
African-American men, like most men, are very receptive to any discussion about improving their health care. Being screened for prostate cancer is a simple thing. It's just an added tube of blood when they're checking your cholesterol or they're checking your blood sugar level. It's not a large process to be screened so you know your risk of having prostate disease.
Yeah. Dr. Hall, let's bring you in on this conversation as well. What are some of the things that people might notice that might indicate prostate cancer?
Yeah, this is the difficult aspect of prostate cancer. There are no early signs and symptoms. So if you're looking for a change in urination or blood in your urine or pelvic pain, you're not going to see that, and you don't want to see that. That would indicate that possibly the prostate cancer, if you have that, would be very advanced. We want to detect prostate cancer in its curative stage where the survival is over 99%. And that's why that simple blood test, the PSA, is so important, because there are no early signs and symptoms of prostate cancer.
Are there preventives that we can do that would maybe boost our chances of not getting prostate cancer?
So this gets into this non-modifiable and modifiable risk factors. What can we do to lower our risk? And this is one disease where we have many what we call non-modifiable, meaning your age. The average age of prostate cancer is 69 years old. It's more likely in men with a strong family history and men of African-American descent. We can't change any of that, can we?
No.
So that's what we mean by non-modifiable. So unfortunately, our studies around diet or exercise haven't shown a significant reduction in developing prostate cancer, which is why that PSA, that simple blood test, is important.
Dr. Bullock, again, with us here this morning on Indiana in the Morning. Dr. Bullock, with black men especially, does the extra prevalence of prostate cancer among black men sort of mandate that they be extra vigilant and maybe even get in for screenings earlier than others might?
Yes. So the American Cancer Society has suggested that men at greater risk, which includes African American and men with a family history of prostate cancer, get their first PSA blood test at the age of 45. If a person has multiple family members with prostate cancer, some suggest that your first screen be done at age 40. For those without increased risk, 50 and above, that they get a yearly PSA.
It occurs to me that there might be some men out there, and not just black men, but any men, who might not know where to start this whole process. What should they do? Is it a visit to your PCP, or who do you see?
Yes, so 90% of the PSAs, that simple blood test, is performed by a primary care physician. So your health care provider can do this test in their office. It's a simple blood test that requires less than a teaspoon of blood. So while they're checking your kidney function, your cholesterol level, they can add on a PSA. So this is a simple test to do to check the health of the prostate gland.
And there are a lot of different options, aren't there, for treatment when it comes to prostate cancer?
Absolutely. So one of the most common treatments for prostate cancer is no treatment. We call it active surveillance. So some men have such low volume, low grade prostate cancer that we advocate that they initially just observe. We do additional tests to try to prove that this cancer is not more severe. But for those who have life-threatening prostate cancer, the options of prostate removal or radiation therapy to the pelvis as your primary curative options are presented. But there are many other options: focal freezing, hormone ablation. There are many ways of managing prostate cancer. It's just important that you get in with a very good person who specializes in prostate cancer.
1 out of 7 black men are going to be diagnosed with prostate cancer. Where are we going to learn more? What are the resources for us?
So there is the American Cancer Society that has excellent resources, and the Astellas website, also Astellas.com, has excellent resources for men. And that's a good place to start, those 2 websites.
All right.
One site is knowyourprostateplan.com. Knowyourprostateplan.com.
Beautiful. Well, Dr. Lannis Hall, Dr. Arnold Bullock, thank you so much for visiting with us. I know you've got another interview lined up in just another minute on another station, but we're glad you took some time out of your day to spend with us.
We appreciate your time and dedication to this cause.
Have a great day today.
Thank you so much.
Thank
Bye.
you.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.